Have you started noticing that your erections are not as firm as they used to be? Maybe intimacy doesn't feel as satisfying anymore, or your body simply doesn't respond the way it once did. If that's been happening, don't rush to blame your age. The truth is, one of the biggest reasons many men experience these changes has nothing to do with getting older. It often comes down to private habits that have been repeated for years without realizing the long-term impact. One of those habits is masturbation. It may sound surprising, but the way you stimulate your body can slowly teach your brain and nervous system to respond in unhealthy ways. Over time, these patterns can reduce sensitivity, affect healthy blood flow, and make it more difficult to achieve or maintain a strong erection. The unfortunate part is that very few men ever talk about this. Even fewer understand that they may be repeating the same mistakes day after day, allowing those habits to quietly work against them. Instead of improving sexual health, they unknowingly train their bodies toward weaker performance, lower confidence, and increasing frustration. In today's discussion, I'm going to walk you through the 4 most common masturbation mistakes that often contribute to erectile dysfunction, especially in men over the age of 50. More importantly, I'll explain practical and natural ways to correct each one so your body can begin working for you instead of against you. Make sure you stay with me until the end, because these simple adjustments can make a remarkable difference. Many men notice stronger erections, healthier prostate function, improved sensitivity, and a renewed sense of confidence once they begin changing these habits consistently. Before we continue, take a quick moment to support the channel by pressing the like button and subscribing if you haven't already. I'd also love to know where you're watching from today, so leave your country or city in the comments. It's always encouraging to see this community of men growing from every corner of the world. Now, let's begin with something every man should understand. Erectile dysfunction is not simply an unavoidable part of aging. Yes, it's true that testosterone levels gradually decline over time, and blood vessels naturally become less flexible as we get older. Those biological changes are real. However, they are only one part of the picture. The habits you repeat every week, every month, and every year have an enormous influence on how your body performs. The way you stimulate yourself can actually reshape how your brain responds, how your nerves communicate, how your circulation functions, and even how your hormones react during sexual arousal. Think about how the human body works. Your brain is constantly learning through repetition. Every repeated action strengthens certain pathways inside your nervous system. If you continue exposing your body to the exact same type of stimulation for years, your brain eventually starts expecting that specific pattern every single time. The problem is that many of today's common masturbation habits are very different from the natural forms of stimulation your body was originally designed to respond to. As those artificial patterns become stronger, the nerves responsible for pleasure can slowly become less sensitive. Blood circulation during arousal may become less efficient, oxygen delivery to erectile tissue may decrease, and your body can begin relying on unrealistic stimulation just to become fully aroused. The encouraging news is that your body is incredibly adaptable. Just as unhealthy habits can train your system in the wrong direction, healthy habits can help restore normal function. Your brain can learn again, your nerves can recover, your circulation can improve. With patience and consistency, your body is capable of rebuilding healthier sexual responses. If this is your first time here, welcome. I'm Dr. Jocelyn, and for the past 5 years, I've worked as a urologist, helping men manage concerns involving prostate health, erectile function, hormonal balance, and overall male wellness. Throughout those years, I've seen one important truth again and again. You are not broken. You are not beyond help. And growing older does not automatically mean your best years are behind you. In many cases, what needs to change isn't your age, it's your habits. Once you begin replacing harmful routines with healthier ones that support blood flow, nerve sensitivity, and natural arousal, your body often responds far better than you might expect. So let's begin our countdown of the 4 biggest masturbation mistakes that quietly contribute to erectile dysfunction, along with the healthier alternatives that can help restore stronger performance naturally. The first mistake is one that has become extremely common in today's digital world: constantly relying on adult content every single time you masturbate. At first, it may seem completely harmless. In fact, many men find it exciting because it provides endless variety, instant stimulation, and intense visual excitement whenever they want it. With just a few clicks, the brain is exposed to more novelty than it would naturally experience over a very long period of time. But this is exactly where the problem begins. Your brain was never designed to process that constant level of artificial stimulation. Human sexual arousal naturally develops through real-life experiences such as physical touch, emotional connection, attraction, anticipation, scent, imagination, and genuine intimacy. Those are the signals your nervous system evolved to recognize. When those natural signals are repeatedly replaced by highly stimulating digital content, your brain slowly adapts. Instead of responding to normal levels of attraction, it begins expecting stronger and stronger stimulation before releasing the chemicals responsible for sexual arousal. Over time, that adjustment can make natural intimacy feel less exciting than it once did. As this pattern continues, important chemical messengers inside the brain begin responding differently. Dopamine, which plays a major role in motivation and sexual desire, no longer rises as easily during normal intimacy. Nitric oxide, the molecule responsible for relaxing blood vessels and allowing strong blood flow into the penis, may also be released less effectively because your brain has become conditioned to expect unusually intense visual stimulation before fully activating the arousal process. The emotional effects can be just as significant as the physical ones. Many men begin noticing that real-life intimacy feels slower than it once did. Moments that should feel exciting no longer create the same anticipation. Instead of enjoying the connection with a partner, the mind keeps comparing real experiences to the unrealistic level of stimulation it has become accustomed to seeing on a screen. Eventually, this conditioning starts affecting everyday sexual performance. You may discover that erections become difficult to maintain without visual content. Even when you're alone, trying to rely only on your imagination can suddenly feel much harder than it used to. Sensitivity decreases, confidence starts slipping, and performance anxiety quietly begins taking over. Many men assume something is seriously wrong with their bodies when, in reality, their brains have simply learned an unhealthy pattern over time. The good news is that the brain is remarkably adaptable. Just because it has learned one pattern does not mean it cannot learn another. Just as repeated unhealthy habits created the problem, healthier habits can gradually restore normal function. Recovery does not happen overnight, but it absolutely can happen with consistency and patience. The first step is surprisingly simple. Give your brain an opportunity to reconnect with natural forms of arousal. Instead of automatically reaching for a screen every time, allow your imagination to become part of the experience again. Think back to meaningful memories, focus on genuine attraction, or simply become more aware of the physical sensations your own body is creating. Pay attention to subtle details that are often ignored. Notice the feeling of touch against your skin. Pay attention to your breathing. Become aware of the warmth throughout your body. Even the smallest sensations help strengthen the natural pathways that support healthy sexual function. These are the signals your nervous system was originally designed to recognize. Don't be discouraged if the first few attempts feel different. Many men worry because arousal seems weaker in the beginning after reducing adult content. That response is completely expected. Your brain is adjusting. It's learning to respond to healthier stimulation instead of depending on constant novelty and exaggerated intensity. Think of it much like exercising a muscle that hasn't been used in a long time. At first, progress feels slow. The body resists change because it has grown comfortable with old routines, but with repetition, strength returns. The same principle applies to your brain and your sexual response. Within several weeks, many men begin noticing encouraging improvements. Natural arousal becomes easier to achieve. Erections feel firmer because the body no longer depends on unrealistic stimulation to activate healthy blood flow. Sensitivity gradually returns, and intimacy begins feeling enjoyable again instead of stressful or disappointing. Remember, your brain is the command center of your entire sexual response. Every erection, every sensation, and every emotional connection begins there. When you train your brain to respond naturally again, the rest of your body often follows. Now let's move to the second mistake, one that is often misunderstood because many people believe it's always beneficial. I'm talking about edging. When practiced correctly, edging can actually be a useful technique. Bringing yourself close to climax before slowing down can improve awareness, increase stamina, strengthen control over ejaculation, and sometimes make orgasm feel more satisfying. Used with moderation, it can become part of healthy sexual function. The problem begins when moderation disappears. Many men repeatedly push themselves right to the edge of climax, stop abruptly, then immediately begin building arousal again. They repeat this cycle over and over, sometimes for 45 minutes, an hour, or even longer, believing that more time automatically leads to better results. From a biological perspective, your body experiences something very different. Each time you approach climax, your nervous system prepares for completion. Hormones are released, muscles contract, heart rate increases, and blood flow reaches its peak. Then, instead of allowing the natural process to finish, everything is suddenly interrupted. Imagine pressing the accelerator of a car all the way down, only to slam on the brakes seconds later. Then you repeat that cycle again and again without allowing the vehicle to complete its journey. Eventually, the engine begins experiencing unnecessary stress. Your body reacts in a similar way. Repeatedly forcing yourself to the highest level of arousal before stopping can overwork the muscles of the pelvic floor. Those muscles play a major role in erections, ejaculation, and bladder control. When they remain under constant tension for extended periods, they become fatigued instead of stronger. At the same time, the nerves responsible for coordinating sexual function are repeatedly forced to switch between maximum activation and sudden interruption. Instead of maintaining a smooth rhythm, the entire system becomes inconsistent. Blood flow may become less efficient. Oxygen delivery to erectile tissue may decrease, and maintaining a firm erection can gradually become more difficult. Many men eventually notice two frustrating outcomes. Some struggle to reach climax at all because their nervous system has become confused by constant interruption. Others experience the opposite problem and begin ejaculating much sooner than expected because their natural timing has become less predictable. Ironically, the very technique they hoped would improve performance ends up reducing confidence and making sexual experiences feel more frustrating than satisfying. Fortunately, the solution is not to avoid edging completely. It's to practice it with balance and purpose. Instead of waiting until you are only a second away from climax, ease back much earlier while you still feel fully in control. This allows your body to regulate arousal naturally without forcing your nervous system into repeated extremes. Keep edging sessions relatively short, generally around 15 to 20 minutes, rather than turning them into prolonged endurance exercises. Most importantly, allow the body to complete the natural cycle when you're finished. Reaching a healthy conclusion helps your nervous system reset properly and supports the biological processes that were designed to occur from beginning to end. When edging is approached with moderation instead of excess, it can strengthen control rather than drain it, leaving your body feeling balanced instead of exhausted. Now let's talk about the third mistake, and it's one that many men never even think about because it feels completely normal. That mistake is rushing through the entire experience. Take a moment and think back to when you were in your 20s. Your testosterone levels were naturally much higher. Blood vessels expanded more easily, circulation was more efficient, and the nerves responsible for sexual sensation were incredibly responsive. At that stage of life, your body could often handle quick stimulation without much consequence. Even if you reached climax rapidly, recovery was usually fast, and your sexual response remained strong. As the years pass, however, the body changes in ways that are completely natural. Testosterone gradually declines. Blood vessels lose some of their flexibility. The tiny nerve endings throughout the pelvic region become less sensitive than they once were. None of this means healthy sexual function is impossible, but it does mean your body benefits much more from patience than speed. When you rush through masturbation after the age of 50, your body simply doesn't have enough time to complete the sequence of events required for a full, healthy erection. blood begins moving toward the erectile tissue. But before circulation reaches its maximum potential, the process is already over. As a result, the tissues may never become completely filled with oxygen-rich blood. That detail is far more important than many men realize. Healthy erectile tissue depends on a consistent supply of oxygen. Every firm erection helps nourish the tissues, maintain flexibility, and support long-term function. When blood flow is repeatedly cut short, those tissues receive less oxygen than they need, making it more difficult to achieve the same strength and firmness over time. The effects are often gradual, which is why they are easy to overlook. Erections may not feel as solid as they once did. They may disappear sooner than expected. Climaxes can begin feeling less satisfying, leaving you with the sense that something is missing even though you can't quite explain why. Emotionally, this becomes discouraging. Many men start questioning their masculinity or assuming that aging alone is responsible. Some lose confidence before intimacy even begins because they expect disappointment. Others become anxious every time they anticipate sexual activity, creating even more tension that further interferes with healthy erections. In reality, your body is often responding exactly as it has been trained to respond. If every experience is rushed, your nervous system learns to associate arousal with speed, instead of allowing the natural progression that supports healthy blood flow and stronger erections. Fortunately, changing this habit is both simple and highly effective. Start by slowing everything down. Give your body permission to respond at its own pace, instead of trying to reach the finish line as quickly as possible. There is no prize for rushing. In fact, allowing arousal to build gradually gives your cardiovascular system enough time to deliver the blood flow your erectile tissue depends on. One of the most effective techniques you can use is controlled breathing. It sounds almost too simple, but proper breathing has a direct influence on circulation and relaxation. Take a slow, deep breath in through your nose, allowing your abdomen to expand naturally. Then breathe out gently through your mouth without forcing it. This steady breathing pattern helps calm the nervous system, reduces unnecessary stress hormones, and encourages the production of nitric oxide, a molecule that relaxes blood vessels and improves circulation. Better circulation means healthier blood flow, and healthier blood flow supports firmer, longer-lasting erections. At the same time, pay attention to the muscles throughout your body. Many men unconsciously tighten their abdomen, thighs, buttocks, or pelvic floor while becoming aroused. That constant tension restricts circulation and forces the muscles to work harder than necessary. Instead of clenching, consciously allow those muscles to relax. Let your shoulders drop. Release unnecessary tightness in your legs and pelvis. The more relaxed your body becomes, the easier it is for blood to move freely into the erectile tissue. Think of arousal like building a steady fire rather than lighting a piece of paper. A paper flame burns hot for only a few seconds before disappearing. A carefully built fire grows slowly, burns consistently, and produces much more lasting warmth. Your sexual response works in much the same way. When you allow arousal to develop naturally, instead of forcing it, erections become stronger because they are supported by complete circulation rather than rushed stimulation. Climax often feels deeper and more satisfying because your entire body has participated in the experience instead of racing through it. Many men also notice another important benefit. Intimacy with a partner becomes less focused on performance and more focused on connection. Instead of worrying about speed or results, they become present in the moment, making the entire experience more relaxed, enjoyable, and emotionally rewarding. Every time you choose patience over rushing, you're sending your body a different message. You're teaching your nervous system that healthy arousal develops gradually, that blood flow deserves time to build, and that pleasure does not need to be hurried. Those repeated lessons slowly become your new normal, strengthening your sexual response with each healthier experience. Now let's move to the fourth and final mistake, one that countless men have developed without ever realizing its long-term consequences. It's commonly known as the death grip, and although the name sounds dramatic, the effects it can have on sensitivity and erectile function are very real. The so-called death grip refers to using an unusually tight grip combined with fast, repetitive friction during masturbation. For many men, This habit develops gradually over the years. Because it consistently leads to orgasm, it feels effective, so there seems to be no reason to change it. The problem is that your body quietly adapts to that level of pressure, and over time, those adaptations can work against your natural sexual function. From a biological standpoint, excessive pressure compresses the tissues and temporarily limits healthy blood circulation. While this may not seem significant during a single session, repeating the same intense stimulation for months or years places unnecessary stress on the nerves responsible for sexual sensation. Just like any part of the nervous system, these nerves adjust to the type of stimulation they receive most often. As your body becomes accustomed to firm pressure and rapid friction, lighter, more natural forms of touch may no longer produce the same response. The nervous system begins treating gentle stimulation as insufficient because it has been trained to expect something much stronger. This is not because the nerves are damaged beyond repair. Rather, they have adapted to an artificial pattern that no longer matches real-life intimacy. The effects eventually become noticeable. Erections may take longer to develop or become harder to maintain. Pleasure can feel muted, even though everything appears physically normal. Some men discover that they can reach climax when they are alone, but struggle during intimacy with a partner, because the stimulation is completely different from what their body has learned to expect. That experience often creates confusion and frustration. Many men assume they are dealing with a serious medical condition when, in reality, their nervous system has simply become conditioned by years of excessive pressure. As confidence begins to decline, anxiety frequently increases, and that emotional stress can further interfere with healthy erectile function. Fortunately, this habit can be reversed with consistent practice. The first step is surprisingly straightforward. Reduce the amount of pressure you use. At first, lighter stimulation will probably feel less intense because your nervous system has become accustomed to stronger sensations. That temporary difference is completely normal and should not discourage you. Remember, your goal is not to chase maximum intensity in the moment. Your goal is to restore your body's natural sensitivity for the long term. Every time you choose gentler stimulation, you encourage your nerves to become responsive again to normal, healthy touch. It's also helpful to vary your technique instead of repeating the exact same movement every time. Small changes in rhythm, speed, hand position, and pressure expose the nervous system to a wider range of natural sensations. This prevents your brain from becoming locked into one narrow pattern of stimulation. Another valuable habit is using a quality personal lubricant. Lubrication decreases unnecessary friction, reduces stress on the skin, and allows movement to feel smoother and more comfortable. Less friction means less irritation, better protection for delicate tissue, and a more natural experience overall. Think of this entire process as rehabilitation for your nervous system. When someone recovers from an injury, they don't immediately expect maximum strength on the first day. They rebuild gradually through consistent practice. Your sexual sensitivity follows the same principle. Improvement happens step by step as healthier patterns replace older ones. During the first couple of weeks, progress may seem slow. That is perfectly normal. Your brain and nerves are learning to recognize natural stimulation again after years of conditioning. The important thing is to remain patient and avoid returning to old habits simply because immediate results are not obvious. With consistency, many men begin noticing meaningful improvements. Sensitivity gradually increases. Erections become easier to achieve because the body is responding to healthier stimulation rather than depending on excessive force. Sexual pleasure begins feeling richer, more balanced, and much closer to what natural intimacy is meant to provide. Perhaps the greatest benefit is the renewed connection with a partner. Instead of needing unusually strong pressure to stay aroused, your body starts responding to ordinary touch once again. Intimacy becomes less about overcoming physical limitations and more about enjoying genuine closeness, comfort, and emotional connection. By letting go of the death grip, you are not giving up pleasure. Quite the opposite. You are giving your nervous system the opportunity to recover the sensitivity it was designed to have from the very beginning. Now let's bring everything together. If you remember nothing else from today's discussion, remember these 4 essential changes. First, Reduce your dependence on adult content and allow your brain to reconnect with natural forms of arousal. Second, if you practice edging, do it with moderation instead of turning it into an extended endurance session that exhausts your pelvic muscles and nervous system. Third, slow the entire experience down. Give your circulation enough time to support a full, healthy erection by breathing deeply, staying relaxed, and allowing arousal to build naturally. Finally, use a lighter touch, vary your technique, and make lubrication part of your routine so your nerves can gradually regain their normal sensitivity. These 4 adjustments may appear simple, but together they create a powerful foundation for healthier erectile function. They support better circulation, healthier nerve responses, improved confidence, and a much more satisfying sexual experience. Most importantly, they work with your body's natural physiology instead of forcing it to adapt to habits that slowly reduce performance over time. Before we finish, I want you to remember one message above everything else. If you've been dealing with erectile dysfunction, weaker erections, or reduced sensitivity, it does not automatically mean that your body is failing you. It does not mean you're simply too old, and it certainly does not mean that there's no hope. In many cases, your body has simply adapted to the habits you've repeated for years. The encouraging part is that those same habits can be changed, and when they are, your body often responds in ways that surprise you. One of the greatest strengths of the human body is its ability to adapt. Every healthy choice you make sends a new signal to your brain, your nervous system, your blood vessels, and your hormones. Over time, those small signals become new patterns. Those new patterns become healthier habits, and healthier habits create healthier results. Imagine approaching intimacy without the worry that's been following you for months or even years. Imagine feeling relaxed instead of anxious, confident instead of uncertain, and excited instead of discouraged. Picture yourself experiencing stronger erections, improved sensitivity, and a level of natural pleasure that feels genuine rather than forced. That future is not reserved for only young men. It remains possible at every stage of life, when you begin supporting your body instead of working against it. The truth is that erectile dysfunction should never be viewed as an unavoidable consequence of aging alone. While age brings natural changes to the body, your daily habits often play an equally important role. Harmful routines slowly weaken your sexual health, while healthier routines give your body the opportunity to recover and perform at its best. So here's the challenge I want to leave with you today. Don't try to change everything overnight. Instead, choose just one habit from today's discussion and begin working on it today. Maybe it's reducing your reliance on adult content. Maybe it's slowing down instead of rushing. Perhaps it's using a lighter touch or practicing healthier edging techniques. Whatever you choose, take that first step and stay consistent. Remember, lasting improvement doesn't come from one perfect day. It comes from hundreds of small decisions repeated over time. Every healthy choice tells your body, I'm investing in my future. I'm investing in my health. I'm investing in my confidence. Those daily decisions eventually become the foundation for stronger erections, healthier circulation, better sensitivity, and greater satisfaction during intimacy. Most importantly, be patient with yourself throughout the process. Recovery is rarely instant, but progress is absolutely possible. Give your brain time to create new pathways. Give your nerves time to regain their sensitivity. Give your blood vessels time to respond to healthier habits. When you remain consistent, your body has an incredible ability to reward your efforts. I also want to remind you that persistent erectile dysfunction can sometimes be an early warning sign of other medical conditions, including diabetes, high blood pressure, heart disease, hormonal imbalances, or side effects from certain medications. If your symptoms continue despite making healthy lifestyle changes, don't ignore them. Speak with a qualified healthcare professional or a urologist. Identifying the underlying cause early can make a significant difference not only for your sexual health but for your overall well-being. At the end of the day, your sexual health is only one part of your overall health. Taking care of your body through regular exercise, quality sleep, balanced nutrition, stress management, maintaining a healthy weight, avoiding tobacco, and limiting excessive alcohol consumption all contribute to better circulation, healthier hormone levels, and improved erectile function. These lifestyle choices work together with the habits we've discussed today to support long-term wellness. Thank you for spending your time with me today. I truly hope this information has helped you better understand how simple everyday habits can quietly influence your sexual health, and more importantly, how those habits can be changed. If you found this video helpful, please support the channel by clicking the like button and subscribing for more evidence-based men's health education. Share this video with someone who could benefit from hearing this information, because one conversation can make a real difference in someone's life. This is your health. This is your confidence. This is your future. Take care of it, stay consistent, and never underestimate what small daily improvements can accomplish over time. I'm Dr. Jocelyn. Thank you for watching, and I'll see you in the next video.